Um, as we're getting started, a few housekeeping things. If you've never been to a mini AMA before, welcome. This is our twice monthly virtual interactive education series where we are joined by subject matter experts to answer your questions. And actually, this topic is back by popular demand because, Marika, you did a session at a previous event that we had, and there were way too many questions for the amount of time. So we knew that we had to have a follow-up one. And of course, things have changed a lot in the couple months that we did that session. So my name is Maria Plussel. I'm the executive director of Ministar. We're the nonprofit community organization that's built to nurture and engage those interested in technology through meaningful connection. We organize a bunch of different events around town, like Minibar, which is the nation's largest and longest running unconference, which is a user-generated conference, Mini Demo, which is geek show and tells, and this. So we are really excited to have these amazing epidemiologists here to answer your questions. A couple housekeeping items if you have never used Crowdcast before. There's a couple functionalities that we're going to be using today. So there's the chat, obviously. And then if you look at the bottom, there's an Ask a Question button. If you drop your question in either one of those, we will pick it up and get your questions answered today. But yeah, use either the chat or the Ask a Question function. Before we jump in and get started, I would actually love for our panelists to introduce themselves. So Marika, why don't you go first?
Great, thank you, Maria. I'm Marika DeCure. I'm an epidemiologist in infectious diseases, and pretty much every infectious disease epidemiologist became a COVID epidemiologist last March. So didn't focus on anything respiratory before this, but a lot of the same kind of concepts apply to both. And then, I also am a spouse of Matt here, who is a big fan of Minibar and Ministars and all of the mini things. So he asked me to come and do a talk last fall, I think it was. Who knows? Time is a feeling these days. Ben asked Maria asked if I would do this. And so I said yes. And then just today, I conned my coworker, Dana, to come and help.
Dana, do you want to introduce yourself?
Yeah, my name is Dana Eichmeyer. I'm an epidemiologist, and I work with Marika. We did do foodborne illness, and just vomiting and diarrhea, but now we do coughing.
Exactly. Coughing, vomiting, diarrhea, all of it. So if you have foodborne illness questions too, we're happy to answer those.
Absolutely.
But we'll focus on COVID at first.
Fantastic. Well, why don't we do this? Why don't we have kind of a little bit of an overview at the beginning, and then we'll jump into questions. So Marika will take that. But even while we're talking here, if you have questions, drop them down there, and we will pick them up when we go to the Q&A. Marika, why don't you start, and then I'll pop back in with Q&A.
Perfect. So this is us. Some of the questions that were submitted before Maria sent to me. So I just thought we could kind of go through what were the main kind of thoughts that people had and go through those. So kind of one of the questions that we get a lot is, how is vaccine rollout going? And I think it's going really well. So kind of in general, these numbers were like, as of the last time they were put in the public. In Minnesota, we've got over 42% of people have who are over the age of 65 have gotten at least one shot. And then I think it was like 700,000 people, have had a dose. And that includes the healthcare workers and people over 65 and people who live in group homes, those types of things. So I think that it has gone extremely well. There's a limited supply of vaccine in general. And so that's the real slowdown, is just there isn't enough. I think we're not really used to that in the Western world of just there's not anymore. So even if you want it, you can't have it. So I think we're doing a pretty good job of getting it out there. There's definitely been hitches and weird things that have happened, and it's never been done to get this much vaccine out in this kind of way where we don't have the supply already on hand. And And I think one of the things that we're doing really well is using the system that's already in place. So we already have a good distribution system for vaccine. We give out hundreds of millions of doses of vaccine every year. This is just like a more anxiety-filled type of dosing that's going on. Don't you, Dana, do you think so too? Is that?
Yes, it's not, yeah. We do this every year. It's just this one has 2 doses and there's a lot of feelings involved.
Exactly. There's a lot of feelings involved. So there are definitely places where we could be doing it better, and are actively working towards that as far as I've seen. And so I think that in general, it is going very well. I have not seen anything where I've been like, that is terrible. I'd love to know what other people are worried about with vaccine rollout, but yes. I think one of the places that is doing I'm a little bit more like anxious about is the fact that like all of these rich countries are getting vaccine out and are going to have their populations mostly vaccinated by mid 2021. And then all of the lower income countries are going to be like multiple years behind us. So just a reminder that like health equity is not just within the US, it is a global pandemic and it is a global disease. And so every time that we get more vaccine for US citizens and residents, that is less vaccine for other people. So that's where we're going to see variants and stuff start popping up. There's variants in the US, but I don't know. That was one thing that I was thinking about when I was looking at questions is like, oh. Speaking of variants, I don't know. I'm medium worried. Are you medium worried, Dana?
I would say medium worried.
Yeah.
Yes.
Like, it's not unexpected. It's totally expected that viruses will mutate slightly, and that's their whole goal, is to be better at transmitting. So that makes sense that that's what we're seeing. Very normal for mutations to happen. I don't love that they're getting more transmissible. I don't love that they're getting more virulent too. I think that like so far all the vaccines have maintained being still effective. So that's good. And even like the South Africa strain where it was like not as effective against mild illness, it's still really effective, or the AstraZeneca vaccine was still really effective against severe illness. So again, yeah, like medium worried. I don't know, that last point of like some days I feel like the next wave is coming and it's going to crush us and I'm terrified. And then some days I'm also like, oh, but the vaccines are working really well. I don't know, goes back and forth. Medium worried, not terrified. I don't think I'm like Mike Osterholm, who always thinks that the sky is going to fall. And that the next 14 weeks are going to be terrible. Any thoughts, Dana?
Sorry, there's a screaming toddler in my dining room. Yeah, I think so. I mean, just because a virus mutates doesn't necessarily mean that it's making it worse. Sometimes things go the other direction. And I think as far as the vaccine data goes and what we're seeing in the case counts, not just in Minnesota, but across the country, it seems like things are doing pretty okay.
Yeah.
So medium.
So like this, there were some questions about like what can you do after you get the vaccine? And one thing is that like immunity takes time to build up. So if you get like naturally infected with COVID, you're not immediately immune to it because you're still fighting it off, right? But then after you've successfully gotten rid of the COVID, then you're going to be immune for a period of time. We don't still really know like how long that is exactly, but we go with 90 days because that's what the CDC has told us. That's what we have some evidence for. And then so that's kind of the baseline. It could be longer, it could be shorter. It's probably longer that people are going to be immune for. And so if you're getting vaccinated, same thing has to happen. So if you get like naturally infected or if you get an immunization, there's that time period where your body has to build up the actual antibodies. And so when you first get the vaccine, you're not immune. Like, it's not magically immediate or anything like that. And so they've said about 2 weeks after you're done with your vaccine. So for all of the ones that are 2 doses, it's 2 weeks after your second dose that you're considered immune for that period of time, for 90 days after that last dose. Now, that could change as we get more data. So once you're in that time period, we still do want people to like be cautious. When they did the trials for the vaccine, they're looking at disease as the outcome. They weren't necessarily looking at infection or ability to transmit the virus. That was not the goal of those initial trials. So that's not the outcome that they were looking for. So that's not what we have data on. But as we vaccinate more and more people, we'll be able to find out a little bit more, are you able to transmit if you get infected but don't have disease? So you don't have any symptoms, you're asymptomatic. So we'll be learning more about that. But as we're learning more, like, you just want to be cautious. So I'm not vaccinated. Dana's not vaccinated. So we're going to keep being cautious. Once I get vaccinated and it's 2 weeks after my doses are complete, if that's 1 or 2 shots, I'm still going to be cautious, but I can probably like let down my guard a little bit. If I'm around other people who've been vaccinated, well, it's super unlikely that if either of us are infected, that we will make the other person sick them. We could still infect them, but we aren't going to make them ill necessarily. But like, I'm probably not going to go hang out with people who have high risk diseases or are super old and haven't been vaccinated, just because I don't want to be that person that gives them disease. So you could potentially still spread it at that point, but you can just think of it as like another way to lower the risk. I don't know. What do you think?
I'm hoping that as time goes on, that'll change. Like early on, the CDC, like the recommendations are they're the recommendations at a current time and place. So like at the beginning of the pandemic, like people needed to have 2 negatives before they were released from isolation. Like that lasted like a week, 2 weeks, because we couldn't test anybody. So I'm hoping that the vaccine message also changes as we get more data, because we can't be vaccinating people every 3 months.
No.
But I do think it's going to be an annual vaccine.
Yeah, it probably seems like, it's not going to be like measles
flu,
where you get 1 and you're done. This is going to be more of you need some boosters. That's what it feels like.
Probably. I don't know. We don't know. We're not immunologists.
And then, I also agree. Like the message will change as we get more data. So it's good to remember that like this vaccine is 1 year old. And this disease is like a year and change old. So anything that we have, it's like, for right now, this is what we think we know based on what we have. So, this is what I like. The like, when are we going to go back to normal? What do you think, Dana?
I think so. I think people are going to be really excited, but I do think that the trauma of the pandemic is going to last a long time. Like even now, when I watch movies and I see people like on dates or like close together in a restaurant, it gives me anxiety. So I think that'll stick around for a couple of years.
I agree. I think it will return to normal pretty quickly afterwards, though. Like if we look back at like in 1918, so the CDC just came out with the projections of the life expectancy, and in the U.S., overall it dropped 1 year. For specific groups, it dropped up to 3 years. I went back and looked because I was like, what was it in 1918? It dropped 15 years. 15. Yeah. It went from like around 55 around 55 or 60 to around like 35. It was insane. Now there was also a world war happening at the same time, but in that case, for the flu, like it was a bunch of young people dying. So, but that is ridiculous. Like,
well, but that's also the pre-antibiotic era. So people were used to people were ready to move on, and they can move on faster. They were used to a lot more death than we are in modern times.
Yes. Yeah.
Unfortunately.
No.
But yeah, people love moving on, and the public has a short memory. So
super short.
I would imagine probably by next fall. But I think things like mask wearing while you're sick, that might stick around for a longer time.
I kind of agree. And people being able to like work in more remote environments and like not requiring people to be in the office. I hope that it makes people not work while they're sick, but I think that is just part of the American culture. And it has not changed despite the pandemic. But so like I said, we usually work in foodborne illness, and there are some norovirus, which is spread in the fecal oral route. So it comes from not washing your hands. Those outbreaks are happening again, and they took a nice long time off. We did not have very many foodborne things or person-to-person outbreaks happening, and they have started to pick back up again. So I said, nature is healing. People have stopped washing their hands again. But yeah. And then there was a question about like risk factors and blood type. And I remember hearing about this like in the summer when they were kind of first trying to look at like, why do some people get really sick and why do some people not get really sick? And so you can't do like a randomized control trial for a disease like this. So that's not ethical. So we can't like give people with different types of blood types disease. So the best thing you can do is kind of look at some case control studies and then look at a bunch of those case control studies all together and see if there's an association. I was looking for any studies that looked like they had like a reason behind it. Like, is there something about the blood type that would lead to it? That's not my specialty, but I mean, it seems like it's possible that in those kind of meta-analyses that it was like less likely to get infected and less likely to have severe issue if you had type O blood. But it's like really, really small odds ratios. And so I would not worry about that. Like if I am type A blood and that is not the thing that's keeping me home. So.
Yeah. I think blood type is also, I mean, it's heritable, so it's complicated. And then a whole bunch of other stuff goes along with those blood types.
Yeah, I think it's one of those things that is easy to get large data sets that have that. Like you can purchase large data sets that have blood type along with other things. And so that is a way that I think it's one of those things that gets studied frequently because it's available. But yeah, being inherited, that we definitely know that there are some things that appear to be familial that make it much more likely to get severe illness, because we do see those severe illnesses happening in families. Pregnancy and COVID was another question that came up. Not good. So this is, you're more likely to end up in the ICU than non-pregnant people of a reproductive age. This is just directly from MMWR, which is Morbidity and Mortality Weekly Report. If you want to read up on the latest from CDC, that is the way to do it, is to look at the Morbidity and Mortality Weekly Report. So this was from November. So yeah, getting COVID while you're pregnant is not good. Now it is still like, people who are of childbearing age are not the main people who get the most sick and end up in the ICU. So it's still like relatively uncommon for somebody to end up in the ICU if they're pregnant, but it is definitely more risky than not being pregnant.
That's pretty much true of everything.
Yes, this is true. And I didn't look, I think in this same MMWR, there's also something on like outcomes for the children, but I didn't look at that. If you're interested, we do there is specific surveillance done for pregnancy and COVID. So this is I would say that this is some of the better data that we have.
Yes, definitely.
Yeah, they do chart reviews and definitely a more thorough job of collecting data is done than for your general illnesses.
Yeah, we're not just calling people and asking.
No, verifying. Yep. And then for the vaccine and pregnancy, I would follow whatever your doctor says. And Yeah, so there is a severe risk of illness with pregnancy. So if I were pregnant, I would get vaccinated, but that has to be a discussion that you have. For the vaccine trials, they didn't enroll pregnant people at first, but people become pregnant even when they're in a clinical trial where they're not supposed to. So they didn't notice any negative outcomes during those initial trials, and now they're enrolling, specifically enrolling pregnant people in trials. Yeah. And a pet problem of mine is when people say that the vaccine's going to make them infertile, and I just want to be like, how? How would that work? What is the mechanism? So if you can describe the mechanism to me, then I will start looking into it more, but I don't understand how that would work biologically. And I'll leave my shameless plug for later. And then there were questions about masks and double masking. I don't know. Sure. I wear a mask. I don't have ones to wear double masks, but I also don't go anywhere. So that is.
I bought a second box, so I have like a whole collection of cloth masks for my family, and I got like just a pack at Costco of the surgical ones to wear under it that are disposable.
Yeah, I should get those. The only places that I go are my house and the office. So that's it.
You don't really need them then. Your risk of exposure is low. You don't even shop.
No, I didn't before either. We don't have a card, so we hardly went to the grocery ever before, and then everyone else joined me in the delivery of groceries, and it was frustrating for a few months, but it's evened out now. But yeah, I would say if you're going to be around other humans, sure, wear 2 masks. Seems to be really good. The evidence does seem to show that is helpful at stopping transmission.
Yeah, it's like the 2 shots. The second mask is like that booster.
That
takes it up just a little bit more. It's a booster mask.
Perfect. Okay, that was all I had for those were old slides. So if there are other questions, we'd love to take them.
All right, yeah, we have lots of questions coming through. So I am going to start with, we'll start with this one. My parents have received their second dose. My wife and I haven't. How do we know when it's safe to go see them? They're over 80 and I haven't seen them in over a year. What are the risks to them or to us? And how long should we wait after that second dose?
So I would wait until at least 14 days after their second dose. And then consider like who your interactions are with, and then make the decision. So it is really low risk at this point, right? Those vaccines are 93 to 95% effective, but that's still a portion that's not protected after their vaccine. So I also haven't seen my parents in forever. They're not 80 though. But if once they're 2 weeks after their second dose, I would say that it is relatively safe for you to go visit them. I would not go to a large party or out to eat in the weeks before you go see them. So maintain your kind of what I hope is your normal of not going out very much and not seeing lots of people. And then I would feel pretty comfortable going to see them. I would still suggest if you want to still wear a mask, that's probably another level. But we can also I say it still has to be like, what is your risk outside of that visit? Yeah.
All right. Related question came in through the chat. My in-laws are going to start taking my kids a few days a week / in daycare the other days. Are we supposed to worry again 90 days after their vaccines?
So the way the recommendation is right now, it really does. You're not supposed to change your behavior at all once you're fully vaccinated. It's just you don't have to quarantine if you're exposed for those 90 days. So I would say probably no. I mean, it's all up to your risk level and how you feel about it. But if your in-laws are staying home, they're fully vaccinated, and that's the only place that your kids are going, it's kind of like your bubble is relatively small. You just have to be aware of the size of bubbles of the people in your bubble.
Yeah, but if they're going to daycare a few days a week too, then I think again, like the recommendations are likely to evolve as we learn more. So potentially after those 90 days are up, they'll have good evidence that it actually is they are still immune or still protected. I would say that on a personal level, I would not feel too terribly concerned at that point.
All right, good to know. This question's from Aaron. Can you talk more about the ethics and realities of equitable global vaccine distribution? In your opinion, yeah.
Good one, Aaron.
So in your opinion, what should the U.S. be doing? Is there anything we can do as individuals?
So I think that there is a lot being done. It is, again, it goes back to the limited supply. Like there's just not enough, and they are sending some to countries. They are charging them less for it. They still are charging them for it. I guess you have to if you're going to be manufacturing things and it costs money. But I don't have a good solution to that other than there will be more vaccine because more companies are making more vaccines, more is being produced, but it does feel very unfair.
Mm-hmm. Yeah. Dana, anything to add to that?
I would say, it's definitely that supply issue. Because so we do this with other vaccines. Like we do this with flu, measles, mumps, rubella, all of these things. There are vaccine programs for all of those to distribute to low-income places in the U.S. and in other countries, because disease outbreaks that happen in other countries will happen here if we don't, control them. So we have a model. There's things that can be done, but when there's scarcity, people tend to hoard. But as an individual citizen, I don't think there's a whole lot you can do. And I don't think you should feel bad if it's your turn and someone offers you a vaccine and you want it, you should take it.
Yeah.
Because it's not like it's going to go to another country. It's going to go in the trash if it doesn't go to a person here.
Mm-hmm. Great. Got another question. I have a question about asthma. It doesn't seem to be on the list of high priority comorbidities. Is it not much of an issue?
So it is it is a condition that may be associated with an increased risk of severe illness, but it is not one that is associated with an increased risk of severe illness. I think there are a wide variety of what asthma is, and that is one of the issues. So somebody who has a sport-induced asthma that only comes up if they sprint really hard, they would be considered a person with asthma, as well as a person who cannot make it through the day without, multiple inhaler uses. Those people are going to be at different risk of severe illness, and I just don't think that the studies are there yet showing that it is associated with severe illness versus maybe associated with severe illness. One thing that we are seeing is that since each of the states has been able to decide who gets vaccinated when and who is in those different priority groups, we have, I'm going to call it great. It's a great natural experiment that somebody will be able to do a lot of data analysis on in 5 years and see which way was the better way to do it. And so we are constantly looking and trying to learn. I will say that a lot of those decisions are made at a policymaker level. And so they're looking at kind of the broadest way to get the most people who are going to have the most severe illness. But you can always talk to your primary care provider if you have one, and see if perhaps your condition might because not all conditions can like be on the list, right? You could have a super rare genetic disease. That's not going to make the list, but it might actually like be enough that your primary care provider who does that care would say, oh yes, no, you need to get the vaccine. You are at risk of more severe illness. So if you have extremely severe asthma, that is the thing to talk to your doctor about.
Yeah, there's kind of the catch-all of immunocompromising conditions where all those weird ones can go. But things can mean a lot of different things. Like cancer is on there. That can mean a lot of different things.
Yeah.
That can
Do you
mean
actually
that you
have cancer? Did you have
Yes.
cancer? Are you being treated for cancer?
What kind of cancer do you have? Like,
If you have like a basal cell carcinoma, like you had a mole removed, like.
Yeah, versus do you have a blood cancer or something like that? So
Mhm.
these are all important things for individual clinicians to work with their patients on. But in public health, we kind of have to say broadly, these are the categories.
Mm-hmm.
We have a question from Dustin. Is there evidence to suggest that the immunity will fade, or is the 90 days just the data that we have so far?
So the data that we have so far is what the 90 days is based on. I would say based on what we see with natural infection, there do appear to be people who get reinfected after 90 days. So there is a potential for waning immunity, but I don't think we know how long that is going to be. So like Dana said, like, I would not be surprised if this is the type of vaccine. Maybe we can even like mix it with the flu one. I don't know. Figure out a way to get them all at once.
Different technologies.
But yeah, more of an annual flu shot, annual COVID shot. Maybe longer, maybe it'll be more like Tdap where you get it every 7 to 10 years. But yeah, a 1-year booster is way better than a 3-month booster. So I think we're being very cautious right now. A 3-month booster is ridiculous.
It's unreasonable. No one's going to do that.
No one does not enough people do the flu vaccine, and that's 1 year. So.
Yeah. But there's nothing magic about infection or immunity either. So everyone's body responds very differently. And there's really no way to know who those people are. So some people will clear an infection like immediately. Like once they feel better, they're done. They're no longer shedding viable virus. And then other people, especially people who are immunocompromised or are taking some kind of medication or older people, will shed for a really long time. So there can be a long tail on their infection. So everybody's immune system is different. So we don't know. Sigh.
Got a question from Doug. What is the latest data on whether a fully vaccinated person can still spread the virus to others?
I don't know.
That wasn't in the initial trials. Like I said, they were looking for disease, not infectiousness, or not infection, and not ability to infect. I think they are. I feel like I saw that recently, that they are currently looking at that with the ongoing trials, because everyone who was in the initial vaccine trials, they get to stay in and they get followed.
Yeah. So essentially the vaccine, I like to think about it, and seasonal flu, like you might still get the flu, you might still get COVID, but the likelihood that you'll be hospitalized or die is almost nil, like depending on who you are. So we don't know if it's vaccine against illness.
Gotcha. We got a question from Matt. What have been some of the technological challenges behind the scenes at MDH, if you're able to talk about any of them?
Nope. No, we are not representing the Minnesota Department of Health. So correct. We are just epidemiologists here to provide you with answers, but I'll tell him after this.
All right. Well, we have another question from Matt. I have a question about hugs. Is there a safe way to hug a friend or family member right now if they're not in your pod?
So this has come up, as you can imagine. So yes, the like risk of one short interaction with a person is relatively low, I would say. So if you, and again, it depends on what you're doing outside of that and what they're doing outside of that hug. There's just like that hug has 14 days on either side of it that you need to be considering. So if you
everybody wants hugs, Marika. Right, I could tell people it's okay. No.
It's fine. It's fine. If you're being safe and they're being safe, you can hug. Maybe you can do a backwards hug. No.
It's funny you mentioned that because in the chat, Aaron said, my friends have wrapped themselves head to toe in bed sheets and done hugs outdoors, and they call them ghost hugs.
I would say if you're wearing a mask and they're wearing a mask and they have like you don't have any high risk exposures in the past 14 days and neither do them, go ahead, hug. I won't be joining you, but I didn't hug before the COVID.
All right. Question from Dustin.
I'm sorry, Kristen. I saw Kristen's, somebody hugged me the other day and I panicked and I was like, yes, I would feel that too.
Oh my gosh. Yes. Janessa, all the hugs. All right. So Dustin's question, can we all agree to eliminate the handshake from our back to normal future? Thoughts on that?
It's a bold plan. I think that some people might not go back to that, or there will be that really awkward moment where someone goes in for the handshake and you're like, oh no, I don't do that anymore.
Well, it might be generational. Like younger people who like never they hadn't gotten to that spot where they had to like learn how to give a good handshake, and then they're just never going to get that skill, and then maybe it'll go away.
Yeah. I don't know. I'm good with the awkward like wave from a distance.
Yeah.
Like the elbow bumps. Mm-hmm. Chip has a question. I'm a 55-year-old male. I know I am later on the vaccination list. Do I just check with my doctor in the summer on when I should get time to get vaccinated?
I would check out the fun infographic that was released today and see kind of an approximate time period. I would agree. I think that you're kind of like late spring is the proposed timeline for people who are 55 plus. Yes, thank you, whoever put the fun graphic in there. I would just wait and check with your provider. I honestly think the vast majority of people are going to get their vaccine not through some giant vaccination center. I think it's going to be mostly through centers that are set up by your healthcare provider or by the county that are through like a community healthcare provider, the community clinics, or through a regular pharmacy. So like, how do you get your flu shot? That's probably how you're going to get your COVID shot. Now, like, again, if you work in a special industry, if you have an underlying condition, if you get magically selected for the lottery, you know, there's other things, but I think most people are just going to get it through the standard method. Yeah.
Right.
You can sign up for the vaccine connector. It's fine. It's fine. Those are my personal feelings on it.
All right. Well, a question from Jill. Could you please explain the efficacy of the first shot? I read somewhere that you are 80% immune after a few weeks and before the second shot.
Yeah, I don't remember the exact number, but that sounds right. So like after that first shot, you get 2 weeks later, you've got some immunity. And then you get the booster and you're up at that like 93 to 95%. So yes, it still takes that kind of 2 weeks from your initial shot to build up immunity, but you are partially protected after one.
Perfect. Aaron says, I'm going to go out on a limb and assume you two aren't hanging out with large groups of people or eating in restaurants.
No.
What will have to be true before you feel comfortable doing those type of things again?
Oof.
I don't know. I think to be truly comfortable sitting in a restaurant, I mean, I have young children, so I never really went out anyways. The last time I went to a restaurant was with Marika on a work trip. I don't know, maybe this summer.
I think that this summer, I expect to be vaccinated sometime in the like middle summer. That's my personal estimation, which has moved forward. I used to think September, and it's moved forward to July. So yeah. I think that I would potentially sit at an outdoor restaurant that is still not crowded, which might be hard to find this summer. And yeah, but like an inside, like a bar or something like that where it's crowded, I definitely need to be vaccinated. And I feel like I need, like, I don't think it'll be until next winter when more people, when everyone who wants one has gotten one.
That also just sounds awful to me, though. I
know.
don't actually want to do that.
But sometimes I do. Sometimes I'm like, oh my
Yeah.
God, that looks amazing. And then sometimes I'm like, I feel so anxious just watching people on TV doing that. So yeah, I think that we've all lived through a lot this year, and it's going to be weird to go back to normal-ish. But yeah, I'm not going to any restaurants, and I feel really weird when I walk by restaurants and there are just people in there with naked faces, just eating and breathing and talking. Yeah.
And that people aren't dying.
Yeah. So, yeah, next fall, next winter.
Yeah. Yeah. Just spray him down with Purell Run, Dustin says. He also had a question around guessing we don't know about vaccine efficacy against long COVID.
I don't think we do. I think we know that it's not, people are not getting severe illness. Like, they weren't getting any illness. So I would think that if you didn't have any illness, you couldn't have illness that lasts for a long time. But I don't know. Viruses do weird things too. Sometimes they just come back like months later and do weird things. Like you could get flu and then end up with alopecia 5 years later. So it's just, there's weird things that happen. So we know that it's really unlikely that you will end up in the ICU or die after you have a vaccine. But the like other random things that weird viruses do, So that's why you still don't want to get it, even if you've gotten the vaccine. You still don't want to be exposed. So
right.
Yeah.
Alan wants to know, when outdoors, what is a safe distance to maintain? So how long of exposure? Passing a trail at a distance of 3 to 4 feet?
Yeah, outside seems relatively safe from what we've seen. I would say it seems pretty okay. So if I'm walking around the neighborhood and I'm not wearing a mask because I'm by myself, then I'll walk out into the street to not have to walk next to somebody. But that also feels like more of just like a courtesy. Like I don't think that's not a high risk interaction there. You do. It's not like a single virus particle is going to get you sick. Is how I would.
You need a couple.
You do need a dose going on too.
And when you're outside, who knows what these days, everything's changing, but we talk about droplets. So at your arm, an arm's length is kind of how far your droplets go, and then they drop. And when you're outside, there's even more going on with the mixing. So I don't typically wear a mask when I'm outside, but I do, if I'm out for a run and somebody's on the sidewalk, I switch to the other block depending on what's going on. And then, I don't know, I'll turn my head. If I have to go by them, I put a mask in my pocket. So when I'm in Como Park or something that's a little bit more, I'm going to run into more people, I'll put my mask on for that part and turn my head.
Yeah. And if I was going over to somebody's yard for a fire or something, I guess now that it's no longer -40, now that it's +40, then I would still try and stay pretty spread out. So that 6 feet of distance between you, even if you're outside. I think it kind of depends on what the other people do. And again, what their 14 days before look like and what your 14 days before look like, on whether or not I would wear a mask if I was hanging out with people in a backyard for an extended period of time. I think right now with all the variants, I'm a little bit more, I don't know, but yeah.
Matt has another question. Said, "What are your?" This one seems safe. What are your thoughts about getting the vaccine sooner because of your BMI, unrelated to your feelings about how terrible BMIs are?
Go for it.
Yeah.
What are my feelings? Oh yeah, go for it.
Yeah. If you meet the criteria to get a vaccine, go get it. The more people who get the vaccine, the better. And people with high BMIs are often discriminated against in medicine. So yeah, do it.
Mhm.
Cool.
And it is associated with more severe illness.
It is, yeah. Even if you're healthy and have a high BMI. So like, yeah.
Right? It's your turn. It's your turn. Take it.
Finally. Brian wants to know, what are your thoughts on the movie Contagion?
Oh my God. So first of all, my first thought on the movie Contagion is that we work at the Minnesota Department of Health. That's not who we're representing today, but that is
Correct.
where we work. And they make us look like idiots in that movie, and it's very upsetting.
It's for the point of plot exposition, but
Yes.
like the building looks like that conference room looks like one of ours.
Yeah. And we think that
I did not care for that.
They actually made us look worse because we wouldn't let them film at the actual health department. They wanted to film at the health department for the movie, and they wouldn't let them. And so we think that they intentionally made the script make it so that Minnesota looked like just rubes, just people who were like, but how much is this going to cost?
No.
But in general, I watched it again and it made me feel sad.
Recently?
Yes, in, I don't know, just some terrible time when I shouldn't have watched it, like in December,
Why did you do that?
January. I don't know. I'm a glutton for pain.
Why didn't you
Feeling
stop her,
depressed
Matt?
and terrible.
You should have said no.
I know. Matt should have told me that I wasn't allowed to watch it. I
he
forced
should
it
have said
upon I forced it upon us and other people who we watch movies with remotely. But no, I don't suggest watching it. It does make you think like, wow, think of how bad things would be if there was a 30 to 40% mortality rate instead of 1.
Exactly.
Yeah.
Exactly.
Yeah. Dustin wants to know, assuming 90% plus effective immunity, do you have numbers for actual infection chance from resuming normal behavior?
I couldn't hear the last part.
From resuming normal behavior, your chances for infection when there's 90 plus immunity?
No, I mean, I don't think that's a stat that anyone really has, because normal behavior means so many different things.
Yeah. I don't think that I can answer that one. I don't know.
And it depends on the population that you're in. So if you're in an area with low prevalence, sure, do whatever you want. It's unlikely that you're going to get infected. But if you're in a high prevalence area, it changes the numbers.
Yeah. I feel like I saw it for herd immunity for this, that like it's not as high as like you need for measles. You know, you need like above 90% of people vaccinated in order to prevent measles from happening. And I feel like I saw numbers for COVID that were lower. What that means, I don't know. Like, is it like 70% of the population, 80% of the population? But yeah, Dustin says like some people are just not going to get it. And that's, yeah, I think that there are enough people who seem very, very excited and want the vaccine right now. That I think we're going to get to a herd immunity level. Between that and the natural immunity that from all of those infections in the fall, there's a lot of folks who are still immune from their November, December infection. So.
Right. But the problem with natural immunity is that you tend to get pockets, and that's why we still get measles outbreaks, because X percent of the population can be vaccinated, but that's not evenly distributed.
Yeah. And this question is actually related to that from CJ. So thinking through like, will healthcare workers and others who were vaccinated early on need another shot 90 days after their first?
I think that's going to be the one where we see a evolution in what is recommended. So we'll look and see, are those people getting infected? Are there breakthrough cases? How long after their shot did they get infected? Do they have a known exposure? There will be a lot to look at there. And then the decision will be made whether or not another booster is needed.
Yeah, probably TBD, March or April, once 3 months have passed since we just started doing this.
Yeah, but that's what we kept saying with all of the things is like, after 90 days, we were like, oh, well, then they'll come up with new guidance. And then, but we do have a different set of people leading on a federal level. And that might make it so that there are decisions about kind of more federal guidance.
Sure. Amy wants to know, I have teenagers who want to hang out outdoors with friends while wearing masks. With the new variants, how comfortable are you spending time outdoors with people? I don't fully trust them all to wear their masks and social distance at least 6 feet. How is outdoor safety? Yeah. How is outdoor safety with mixed mask use? Is winter or cold air easier to spread?
That is a good question.
I think the key there was that it's teenagers, and so
yes.
you know that I think that you know that the behavior will not be consistent from person to person.
Yeah.
Yeah. I think outside and with a mask is great. Outside and without a mask is better than inside without a mask.
Right. So all of it comes down to behavior, and it comes down to making the best choice possible in the situation. So you can't control teenagers. Like, they're going to do what they're going to do. And if you really lock it down, then they're going to find a way to do something worse than you could in the first place. So maybe as a risk mitigation, like, okay, fine, you guys can get together, but try to stay in, make their pod, and then they can be outside. Like, that's better than outside's better than inside. Masks are better than no masks. Same group of people is better than different group every day. But you have to accept a certain level of risk every time you get up out of the bed in the morning, every time you eat, every time you do anything. Like, nothing is 100% safe. So you just have to draw your line.
Yeah. I think that the risk of like mental health issues for teenagers is probably a lot higher than the risk of their COVID illness. So I would feel more comfortable being like, outside with masks, maybe I like that, like, same group of friends. And then like say, but if you make those decisions, like you can't see grandma until, or those types of things, or X person in your family who has higher risk of illness. And that's the other thing is like, do you live in a household where somebody has cancer and they're at a much higher risk of severe illness? That makes a difference. So.
Aaron wants to know, I know that people under 16 aren't approved to get the shot yet and that they're running trials on older kids now. Do they expect to do trials on very young kids anytime soon? Is it likely that they will recommend my 2-year-old get vaccinated this summer?
That'll be the last group. So
they like step down. They do like 16, they do like 14 to 16, and then they look at like 10 to 14. So.
And because, the younger kids aren't the ones that are most at risk for serious disease. So thankfully with this one, like the vaccine trial ethics line up with like our disease prevention ethics. So that's nice. But like Marika said before, like, we don't do trials for ethical reasons on young kids, prisoners, pregnant women, like places like that. Like, we don't start with them. We start with the general population first. So eventually, probably be like, I don't know, 2 years, 3 years. You see Eileen in the back.
All right.
Yeah, not this. I don't even think like the teenagers are likely until this fall. That's like the earliest timeline. But I could be wrong. Again, I thought I was going to get vaccinated in September, and now I've moved my prediction up to July. So.
Yeah. This might be related to a previous question, but Lindsay wants to know, what do we think late spring means? I'm assuming when it comes to the schedule of vaccine rollout. Do you have any idea?
May, yeah.
May. Good to know. Got 2 questions left in 5 minutes, so this is last call for questions. Kristen wants to know, any thoughts on safety of road races like marathons or music groups like a concert band? Both are my interests in getting pressured to do these activities.
That's tough. My husband's a musician, so we've been dealing with this the whole time, and they've done their Zoom things, and he's asked me really nicely about like, can I do this? Can I do that? And they've done like backyard stuff, but concerts are going to be a tough thing. I don't know if people are going to want to do that. I think people are really desperate to do it, but I don't know. I don't know about live music. And marathons, that's a lot of heavy breathing all close together. It makes me really anxious to think about.
Yeah. I keep thinking like maybe this summer, and then I'm like, no, not this summer. No. I do think that the state fair is going to happen. I don't know if it should happen.
Yes.
It's going to happen.
I think the state fair is going to happen.
Really?
Mm-hmm.
Probably. I don't know.
I don't know. And like, will it be just like limited attendance? And then like, what's the point of going to the state fair if there's only like 50 other people there? I don't know.
Well, even if you limit the attendance, like you can't control where people, like the level of control on that, I think people aren't going to be interested in.
But I definitely think that it's going to happen. I don't think that there's enough will to not.
Yeah, people are done.
Interesting. Dustin wants to know if you're a cancer survivor, is your risk higher than people who have never had cancer? When they say cancer, do survivors count?
Yeah, right? That is a really good question. And they never talk about that.
No. I think for the like what kind I think they say that you have active cancer. Hold on.
Yes.
Pull it up.
And I remember seeing like on one of the CDC like COVID net things, like so they're determining like active malignancies, like have you had treatment in the last 12 months is what I see with it. But it all depends on what kind of treatment that you had. So if somebody had like pancreatic cancer and they took out your pancreas, like you are immunocompromised for life then. So it really depends on what your treatment was and where you're at in your process.
Yeah, it all seems like it's like active cancer, but like that is so vague.
Right. And then cancer survivor can mean a lot of things too. So are you a cancer survivor, like you had childhood cancer and now that was a long time? Or how healthy were you before you were diagnosed with cancer? Like how healthy are you a person like underlying? I think it's a really complicated question. Dustin, I would follow up with your doctor.
Sure.
Not that I think that your risk is necessarily super high, but just I have better answers for you.
Yeah. Looking at time, I want to ask our panelists, we have a few more questions. Do you all have a hard stop, or do you have an ability to answer 4 more questions?
I do. I have a call.
I do not.
You do? Okay.
She's more important than me.
Okay.
No.
Feel free to drop whenever, Dana. We really appreciate you for being on and sharing with this. And Marika, if you're cool, we'll go through these last 4 questions.
Yeah.
So
I want to thank Dana a lot because it's
way
more fun if there's 2 people.
Yeah.
Yes. Thank you.
Super fun. That's awesome having you. Thank you. All right. CJ wants to know, can you please talk about current mutations out there and what we know about them?
Oh, there's just like a whole bunch of variants out there. So anytime that you're having kind of uncontrolled community transmission, every time there's an infection, somebody's going to make a miscopy, and then you're going to end up with a mutation. So I couldn't even tell you all of the different ones that are out there and what we know about them. I just saw today there's apparently a New York variant, and in all likelihood there was and still is a kind of Southern California variant, and there's the Brazil variant, and there's the South Africa variant, and then there's like 2 different UK variants. So there are just a whole bunch out there. And one thing to remember is that we are only sequencing like a portion of them. So in order to know that you have a variant, you have to actually sequence the RNA and be able to compare it. Mm-hmm. And so only a small portion of specimens are ever going to be sequenced. It's just, there's way too much going on. And so when they do find a variant, they're looking to see mostly at this point, like, is it more severe and is it more transmissible? So I think like the Brazilian one is more severe. The South African one is less likely to be, or can break through the vaccine a little bit, not to severe illness again, but to have mild illness after the AstraZeneca vaccine. And then the UK variant is more transmissible and likely is slightly more virulent too. But yeah, they're going to be finding different ones all the time. We have a standard surveillance program to look for those, both Minnesota and then like across the US. So they're looking for variants and trying to find them. So like I said, I saw an article today that there's a New York strain. I don't know anything about it other than that.
All right. Another question came in. We're not going to in-person school, and I'm really worried about how they have reopened. Is fall reasonable for high school / middle school if fall for teens is when they can vaccinate?
Yeah, I think it is likely that schools will reopen. And so one of the other things is that so we've gotten so many of the people who are most likely to have severe disease. Certainly by next fall, we'll get vaccinated most of the people who want a vaccine who are likely to get severe disease. And so while we definitely don't want kids getting infected, we will have hopefully reduced the amount in the community so much that it will be of lower risk for them to be out amongst other people. And then on top of that, again, they're not super likely to have severe illness. And then the people who are likely to have severe illness are going to be protected at that point. And then the last thing is that, like, again, mental health, learning, all of those other parts of health and human beings, those are important too. And so I think the fact that the majority of people who are going to be at most risk to get the most sick will be vaccinated at that point, that will really make it so that it is much better for them to be in school than for them to be out of school. That's my thoughts.
So, a question. I am a partner dancer. I know I'm not doing that with strangers anytime this year, but 2022, 25, should I just get a new hobby?
No, I think kind of what we said is that once most people are vaccinated, if you're vaccinated and your partner is vaccinated for the dancing, then the risk of you getting each other sick is pretty low. And then once most people in their lives are also vaccinated, then it's, again, even more of a risk reduction. So I think 2022 seems, or even the end of this year potentially, for a small dance.
There you go, Erin. All right, this is the last. More hope than the state fair. Good. All right, last question is from Caleb. Got your light, sorry if addressed. I heard the virus can make blood vessels more permeable, and this is why people have varying effects, including blood and brain barrier, etc. Is more cardiovascular virus? Have you heard this? Or you comment on it?
Yeah, I think that the illness that you get from COVID is so broad. So I think that they are still learning a ton about different problems. So definitely there's like blood clots and issues with the cardiovascular system. Cardiomyelitis has been found in a bunch of people who had even just mild illness. And then as well as the lung problems. And even those seem to be, kind of related to circulatory system and lung interface. So it definitely has some weird things. And then it does stuff to your nerves, which is the freaky part for me. I don't know, that part weirds me out even more than any of the other things. So I think we are definitely still learning like the mechanisms for illness. And that I hope will lead to some better treatments, because with this, like preventing illness is great, but I think we're all going to say like this is going to be with us for a while. Like I don't think we're putting this back in the box. We're going to keep getting the vaccines. People will keep getting COVID. It's not going to be smallpox. So I think that finding more and more about the mechanisms of disease and treatment options for that are going to be key going forward. But yeah, I think that's one of the weird things with this is like mild illness is still weird. Like I said, like viruses do weird things and they end up in weird parts of your body and cause random havoc and lead to long COVID and all of those other things. So I think the more we can do to not have transmission, the better it is.
Well, thank you so much, and thank you for the extra 5 minutes of your time. Is there anything that you want to plug?
Yes, get the COVID Aware MN app. Get that, and then if you are out and about, then you can let others know who you might have exposed if you get COVID, and they can let you know if they got exposed and they get COVID. So COVID Aware MN. It's an easy app to get. And if you're into the tech side of things, it's got some pretty cool stuff. So if you want to delve into how it works, the Google Apple exposure notification interface is a pretty fun little tech thing. So
nice. Thank you again. Thank you all of you for your incredible questions. I think we hit a record today of questions, like 26. So thank you for your time. Thank you, everyone. And I hope everyone has a wonderful